What deep brain stimulation does is improve movement. And so if you have a tremor, it can reduce the tremor a lot. It may not make it go away completely, depending on how bad the tremor is to start, but for the most part, people note a drastic improvement in their symptoms.
Deep brain stimulation is a technique to change the way the brain is functioning at an electrical level by implanting a device that can deliver continuous treatment to certain circuits in the brain that have been shown to be helpful in the treatment of Parkinson's disease. So it's a surgical implantation followed by long-term treatment by a device that is implanted and permanently, continuously working.
I call it a therapy, not just a surgery, because the surgical part of it's the beginning, but adjustment of the stimulation and looking at the benefits and potential side effects is a process. It's another way to make people more functional, make them feel better when they have these diseases.
Deep brain stimulation surgery is an FDA-approved procedure for patients suffering from Parkinson's disease, essential tremor, and dystonias. Deep brain stimulation surgery is considered as an extension of your medication treatment. Oftentimes, patients who come to us for evaluation for deep brain stimulation are either having inadequate symptom control. For example, their tremor may not be really responsive to the medication that they are currently on, or they're having a lot of side effect from the medication they're currently taking, or they just cannot tolerate any medication at all. In those situations, we think about deep brain stimulation as a way to help manage their symptom in addition to the medications. From a movement disorder neurologist perspective, the disease that we are working with here are lifelong diseases. These are diseases that patient is going to have for a long period of time. Patients with deep brain stimulation often experience significant improvement in their symptoms. They're able to engage in activities that they may not be able to do before. They feel improved independence, and of course that would then translate into improved quality of life. It also provides us an additional way to manage their symptom if their symptom worsen in the future, that we can have another tool in our box to really help sort of adequate symptom control and maintain the quality of life that the patient wants.
This is a safe procedure overall, but the things that we are always on the lookout for to minimize the likelihood are things like bleeding in the brain.
Generally, the risk of that's very low. It's about 0.5 to 1%.
The majority of those bleeding events are just things that we see on post-operative imaging and can kind of be thought of as a bruise that will just go away in time and be of no consequence whatsoever. But there is a small subset where it could be very neurologically impactful in a negative way.
Other things, again, any surgery you worry about infection. What's a little bit different about this surgery is that if there's infection on the hardware, putting somebody on antibiotics for a little while might not clear the infection.
The risk or the likelihood of that happening is also quite low, and we have a very robust protocol in place that we think works really well in preventing that from happening.
So I am the one who gets to see the patients at 6 months post-op to check in a few months after surgery, and I love those visits. They're some of my favorite visits because I get to hear the positive impact that DBS has had on patients and their quality of life. I had a Parkinson's patient who was able to hold his spouse's hand while they were walking, and a lot of patients are able to get back to activities that they loved, so it's really wonderful to hear that the impact that it's had for people.
We perform over 100 implantations of deep brain stimulation systems per year.
I think one of the appeals, and part of the reason we've grown the program so much over the years and that we do have a high volume, is that when your neurologist sends you to us, they know what they're getting. We have our 2 movement disorder neurologists, the 2 surgeons who do this at UW Medicine, our neuropsychologist, our lead physical therapist is there. There's a lot of moving pieces, and having the people who are right for addressing them is really important.
We have many people involved in the care of individual patients. And we all realize that we see that patient's interaction with their disease from a different angle. And so that perspective is important, and we learn from each other. And having the multidisciplinary approach, we can hear all those vantage points, all those perspectives, and make sure that all those goals and also the concerns are discussed before surgery. We know about them, we're informed about them, the patient's informed about them, and that's the recipe for success.
So we have once a month a Deep Brain Stimulation or DBS Movement Disorders Conference, where the neuropsychologists, the physical therapists, the neurologists, the neurosurgeons, the nurse that works with our DBS patients all get together and talk about the patients that we have as candidates. DBS is a wonderful therapy, but it has to be the right therapy for the right patient. Multidisciplinary care is important, but in particular, a lot of the patient population that we're doing deep brain stimulation in is a really complex population, and a lot of attention to detail is needed in their care. It takes a lot of different teams and people participating and really making sure everything goes smoothly.
The reason that we perform deep brain stimulation is to improve quality of life for someone with Parkinson's disease or essential tremor, and that's the bottom line. That's why we do it. Deep brain stimulation can kind of reverse the clock. We estimate, 5 years or so, and get to a point where people can engage much more confidently in the things that they enjoy. We just want to allow people to do the things that they love.
Most people don't decide to do this, over a weekend. This is something people learn about, they think about. Having those second thoughts, wanting more information, that's a good thing. And, that's what we're here for.
And I would encourage people who have even thought about it to explore it. There's really no risk in exploring it. And so we have created a clinic atmosphere where you come in to build a relationship, to ask the questions you need to ask, to test your comfort with the idea, to be educated about it. We are as interested in making sure it's the right thing for everyone who comes in as they are.